And that Delta variant that first originated in India is now the dominant strain in the UK. And Britain's health minister says the strain is now estimated to be 40% more transmissible than the Alpha variant that was first detected in the UK. So we're going to bring in Dr. Nandy. And Doc, Britain's COVID response was very successful and their numbers substantially dropped. Are they now seeing a rise in numbers related to this Delta variant?
So simply put, Glenda, yes, there's been a rise in numbers. Over the last month, cases in Britain have recently doubled from 2,000 a day to 4,000 a day. Now, these are not huge numbers, but we have to keep in mind, we often see during this pandemic how these numbers feed upon themselves, meaning that once the numbers start moving, whether going up or down, it tends to keep going in that direction, picking up speed and building upon itself. So if the Delta variant is 40% more transmissible, then those numbers could continue to rise, mostly because of two key reasons. One, Great Britain is lifting their restrictions and reopening back up, and number two, roughly 40% have not received a vaccine shot.
Well, that Alpha variant, Dr. Nandy, first detected in the UK, the most dominant strain here in the United States. So do you think what we're seeing in the UK, where that Delta variant overtook that Alpha variant, will we see that happen here as well?
So, Linda, first of all, when we were first talking about, we have to talk about this in a different sense. You were talking about the two-dose vaccines, right? The UK strategy was different than ours. They felt it was best to vaccinate as many people as possible with one shot only. They delayed the second shot by up to 12 weeks. Now that's worked for them, but unfortunately studies are showing this, that getting only the first shot does not provide high enough protection for the Delta variant. So it's possible that more people could get infected if they're not fully vaccinated. And the same goes here for the US, right? We have a lot of folks who have not been vaccinated at all or not been fully vaccinated. So they are more at risk for catching the virus. The good news, if there is any with the Delta variant, is that if it continues to spread both in the US and UK, the death rates hopefully shouldn't spike. Why? Because many older folks in both countries have been fully vaccinated. That's not to say that younger people are completely out of the woods. Many end up hospitalized, and a new study showed that young people often leave the hospital in worse shape than before they came in, right? Before they were infected. So again, if you're not infected, the bottom line is get a vaccine very soon. But we'll keep a close eye on this Delta variant to see what's going on in this country as well.
All right, Dr. Nandy, thank you so much.
My pleasure.
And if you have a coronavirus question for the good doctor, you can email him at drnandy@askdrnandy.com or send it to us on Facebook or Twitter, and we'll get it right to him. Alan.